Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, thanks for seeing me today.
Of course, how can I assist you?
I've been having this persistent cough for a few weeks now. I initially thought it was just a cold or something, but it doesn't seem to be getting any better.
I'm sorry to hear that. Can you describe the cough for me?
Yeah, it's quite deep and sometimes produces mucus. It's worse in the morning, and sometimes I feel like I can't catch my breath after a fit of coughing.
That sounds uncomfortable. Are you experiencing any other symptoms along with the cough?
Yes, I've had a low-grade fever on and off, and occasionally I get these chest pains. I also feel fatigued more than usual.
It's important to get a clear picture. How long have you been feeling this way?
The cough started about 3 weeks ago. The fatigue and chest pains began maybe a week after the cough.
Okay. Have you been exposed to any irritants like smoke or chemicals, or been in contact with someone who had similar symptoms recently?
I do have a colleague at work who had a bad cough a few weeks back. As for irritants, not that I'm aware of. Although I do occasionally smoke socially, but I haven't been recently due to feeling unwell.
Got it. Smoking, even occasionally, can make you more susceptible to respiratory issues. Have you experienced any wheezing or felt a tightness in your chest?
Now that you mention it, I do feel a tightness in my chest, especially when I try to take a deep breath, and there's been a slight wheezing sound when I breathe out.
I see. It sounds like it might be bronchitis, which is an inflammation of the bronchial tubes in the lungs. However, we'll need to run some tests to confirm. Do you have any history of respiratory issues?
Not really. I mean, I had asthma as a child, but I haven't had any issues in years.
It's good to know. Asthma can make you more prone to bronchitis. We'll start with a chest X-ray and some basic blood tests. Meanwhile, it's essential to get plenty of rest, drink lots of fluids, and avoid irritants, especially smoking.
Thank you for the advice. I was really getting worried with the lingering symptoms. I just want to get back to my normal self.
I understand your concerns. Once we have the test results, we'll have a clearer picture and can start a proper treatment plan. In the meantime, try to take things easy and avoid any strenuous activities.
Will do. Thanks again for seeing me. I appreciate your help.
You're welcome. Take care, and we'll be in touch once we have the results.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Dr. Martinez. Thanks for seeing me today. I've been having some intense abdominal pain lately, mostly in the upper right side.
Hello, Mr. Collins. I'm sorry to hear about your discomfort. Can you describe the nature of the pain? Is it sharp, dull, crampy? And does it come and go, or is it persistent?
It's a sharp, stabbing pain, and it seems to come in waves. It's most intense after I eat a heavy meal.
Thank you for sharing that. Do you also experience any nausea or vomiting associated with the pain?
Yes, I've thrown up a couple of times, especially when the pain was at its worst.
Do you notice any changes in your stool or urine? Like, is your stool clay-colored or has your urine been darker than usual?
Now that you mention it, yes, my stools have been pale and my urine darker. I thought I might just be dehydrated.
Those symptoms can sometimes be associated with gallstones. Have you had any fever or chills?
I felt a bit feverish the other night, but I didn't take my temperature.
All right. And do you have any history of gallstones or gallbladder issues in your family?
Yes, my mother had her gallbladder removed in her 40s.
Thank you for sharing that information. Gallstones are hard particles that develop in the gallbladder, which is a small organ beneath the liver. They can block the flow of bile, which can lead to pain and other symptoms. Based on what you've described, it's possible you may have gallstones.
Is there a specific test you do to confirm it?
Yes, an ultrasound is the most common test to detect gallstones. It uses sound waves to create pictures of the gallbladder, liver, and pancreas. Would you be open to having one?
Definitely. I just want to find out what's causing this pain.
Good decision. We'll arrange for an ultrasound. Meanwhile, it's best to avoid fatty foods as they can trigger pain if gallstones are indeed the issue.
What's the treatment if I do have gallstones?
Treatment can vary. Some people benefit from medications that dissolve gallstones, while others may need surgery to remove the gallbladder. We can discuss the best options once we have a clear diagnosis.
Thank you, Dr. Martinez. I appreciate your thoroughness.
You're welcome, Mr. Collins. We'll get to the bottom of this and ensure you get the care you need.